In today's Wellness Wednesday, we're just a couple of days away from Halloween. So how can you keep your smile safe from those potential cavities? Joining me now is Dr. Whitney Bator from the Idaho State Dental Association and Tree City Family Dental. Doctor, thanks for being here this morning.
Thanks for having me, Matt. How are you?
I'm good. Thank you very much. And thanks for being here. So obviously, Halloween, it's almost here. And while it looks a little different, of course, candy is still going to be very prevalent. So what can kids and adults do to keep their teeth healthy?
Yeah, that's a great question. I think it's a common myth that dentists dislike candy, but it's not true at all. We think it's meant to be enjoyed. And there's a few things that we can do and recommend to reduce the risk of cavities this season. The first, of course, is drink lots of water and enjoy your candy with meals. Both of these things are going to increase saliva production, which rinses away sugar residue and keep your teeth healthy. The second is instead of snacking on candy throughout the day, enjoy a few pieces in one sitting. And then rinse your mouth with water afterwards, and then brush shortly after that. It's all about the frequency of sugar consumption, not necessarily the amount at one time that matters that causes cavities. And then the third thing is that people with orthodontics or appliances like retainers and braces, we recommend they stay away from sticky or hard things that can get caught in the brackets and in the wires. And then it's also just a great idea this time of year to make an appointment with your dentist if you don't have one, and make sure that we get in and get things looked at before the busy holiday season.
Gotcha. All good tips. Now, on that last note, of course, we're still in a pandemic, and so many of us have put off going to the dentist for whatever reason, some people including urgent care. So is it safe to go back to the dentist right now?
Absolutely. That's a great question. It's not only safe, but I think it's necessary for maintaining our overall health. Right now with the pandemic, so many people have had a disruption to their daily routines during COVID. And so I think it's really important to reestablish these routines right now. So that looks like twice daily brushing, flossing, exercising, and eating well. And a healthy diet and healthy mouth are really going to increase and boost our immune systems. It's not only going to help us fight off chronic infections like heart disease and diabetes, but it's also going to ensure that we're healthy to fight off acute infections and things like COVID. Additionally, many health insurance plans right now are loosening restrictions for when patients can come in. So traditionally it was every 6 months, but right now they're kind of loosening those restrictions because of COVID. And by keeping regular appointments, it ensures that you find things early, contributing to less pain, less treatment, and ultimately less expensive care. And I do think Idaho dentists have done a great job at increasing safety measures for staff and patients to make things comfortable and safe for you to come in.
Perfect. All right. And we're just about out of time. So last question, where can people find out more either about the safety measures or about your practice or just dental hygiene in general?
Yeah, so a great thing if you have questions, of course, is to call your specific office. There's also lots of information on the ISDA website under the patient resource tab. Things that look different in dental offices right now, of course, is we changed the look of waiting rooms. We're taking temperatures when patients come in. Of course, your staff is going to look different. Lots of extra PPE and lots of extra layers. And then lots of extra suction, air filtration units, and lots of measures to minimize aerosols during treatment for patients.
All right, perfect. Dr. Whitney Bator, thank you so much for being here this morning.
Thank you, Matt.